When you think of medicine, you probably think of doctors and drugs that heal people from various diseases. But you also probably think of services that aren't necessarily directed at curing diseases, such as epidurals given during childbirth. Pregnancy and childbirth aren't diseases, but surely epidurals count as a medical service. So you might think that medicine does more than just address unhealthy conditions of patients. Maybe one of the goals of medicine is also to promote the interests of the patient. I'll call this view of medicine the interest-centric view. A defender of the interest-centric view, Christopher Bors, argues against the pathocentric view of medicine, the view that medicine is restricted to preventing, curing, and mitigating the bad effects of diseases, in his paper, The Goals of Medicine. If the pathocentric view were right, he argues, then we would expect some group of individuals or services at some point in history that were only concerned with fighting pathologies. But in fact, we don't find anything like that. So his argument goes roughly like this. If medicine were pathocentric, then there is or was some group of services which are considered medicine, and those services only fight pathologies. There are no such examples, historically or in the present. Therefore, medicine is not pathocentric. Now, Bors mainly focuses on defending the second premise here. There are plenty of examples, he argues, of services that are or were considered medical services, but which do not address any unhealthy condition of patients. He focuses on two examples, ancient contraception and obstetrical anesthesia. Consider ancient contraception. Contraception has been provided for a very long time, even if it wasn't always effective. In the Hippocratic Corpus, for instance, we find the following recommendation. If a woman does not want to get pregnant, give to her in a drink of water moistened copper ore, and she will not become pregnant for a year. Now you might think that this is obviously bad advice, but whether this was actually effective in preventing pregnancy is beside the point. The physicians of the time thought they were preventing pregnancy. That was their goal. So even if it wasn't effective, those people who practiced medicine prescribed contraception. And importantly, contraception is not a service that addresses any health issue of the patient. Pregnancy isn't a disease. So, Bors argues, we have at least one service provided by physicians that does not address health concerns of the patient. The second example he uses is Victorian obstetrical anesthesia. In the 19th century, physicians used chloroform to help women through the intense pain of childbirth. Queen Victoria, for instance, requested chloroform in 1853 when she gave birth to Prince Leopold. Again, you might think that this is poor medical practice. The point remains, however, that the goal of the physicians was to help reduce pain that is not pathological. The normal birthing process is, in the absence of complications, not unhealthy. So here we have an example of another service that was and is provided by physicians, well, they don't use chloroform anymore, but which does not address any unhealthy condition of the patient. As a result, Bors proposes that medicine provides services beyond those which are concerned exclusively with patient health. Other examples might include abortion, physician-assisted suicide, and purely cosmetic surgeries, so long as these services actually promote the interests of the patient. So, the interest-centric view of medicine claims that medicine is concerned not only with preventing, curing, and mitigating the bad effects of unhealthy conditions, but also with a fourth goal, promoting the interests of the patient through the use of medical knowledge and technology. And this goal, he claims, subsumes the other goals. If some service is not in the interest of the patient, then there is no professional duty, based on the goals of medicine, to provide that service. But this last goal raises a puzzle about his view. What counts as medical knowledge and technology? If by medical he means knowledge and tools that are used in the medical profession, then he needs to tell us what those things are. The tricky thing is, he can't say those things are the services that promote patient interests, since that's exactly what he's trying to prove. One might say that what counts as medical knowledge and technology are those things that make the patient's life improve. But that's implausible, because plenty of things would make the patient's life go better which are clearly not medicine, like helping someone buy a house. So, it seems that in order for Bors's defense of the view to get off the ground, he will have to provide us with some information about what counts as medical knowledge and technology that isn't so broad that it includes any way of improving someone's life within the scope of medicine. So I guess I'll leave you guys with that puzzle to think about. Thanks for watching 5 Minute Ethics. Please like and subscribe.